KSJE is supported by San Juan Regional Medical Center, here to meet your urgent and emergent medical needs, whether they are COVID-19 related or not. Medical emergencies happen when you least expect them. Whether it's a stroke, heart attack, illness, or injury, San Juan Regional Medical Center's caregivers are here to provide care to you and your loved ones. Find out more online at sanjuanregional.com. KSJE is proud to support the Aztec Highland Games and Celtic Music Festival, October 2nd and 3rd at Riverside Park in Aztec. Music from Big Patty, Smelter Mountain Boys, Patrick Crossing and Devil's Dram, and featuring the Highland Games Athletic Competition. Plus, Scottish vendors, food, and clans. Find out more online at aztechhighlandgames.com. Twelve minutes past 8 o'clock. It is Friday morning, September 24th, 2021. Good morning, everybody. I'm Scott Michlin, and thanks for tuning in to KSJE 90.9 FM over the air, of course, in San Juan County, New Mexico. 103.3 FM over the air in Durango, Colorado, and streaming everywhere else on the planet, including to your smart speaker at KSJE.com. Welcome also to our viewers who are watching this visual radio program. It is streaming live this morning to the KSJE Facebook page, our Twitter account, and our YouTube channel. We're glad that you are with us this morning, everybody, because coming up in the next few moments, it is our COVID-19 Community Information Program. Megan Cullip will be joining me, as well as our guest this morning, Dr. Robert Underwood from San Juan Regional Medical Center. He'll be on the air with us with an update on conditions at the hospital, case numbers, and things along that line, answering questions, of course, about vaccines and variants, and much more information to share with you this week. So that is coming up in the next few moments right here on KSJE. And then don't forget, next hour, Mick Hess takes us roving with the arts. Mick is sharing some historical jazz music with us this morning that has been re-recorded recently. It is a jazz orchestra with Andy Baker, with music by Leo Sowerby. That's coming up today on Roving with the Arts at 9:06 on KSJE today. At noon, don't forget, it's the Cop Shop with the Farmington Police Department. Chief Hebby will be here along with Nicole Brown, the Public Information Officer, talking about recent activities of the police department. I was honored to be part of their community discussion earlier this week. I know they'll be talking about that and more coming up at noon today on KSJE. Join us on the radio or online, of course, YouTube, Twitter, and Facebook. Don't forget, in addition to those social media channels, you can connect with us on our Instagram page as well. And if you're a podcast person, a lot of our talk shows and interview programs are KSJE Podcasts. You can subscribe to those for free wherever you hear your favorite podcast. iTunes, Spotify, iHeart, Pandora, Amazon, and Podbean, just to name a few. So we encourage you to check out our podcasts if you're heading off on a road trip or a bike trip or a running trip or whatever the case may be. You'll find some great local information on our podcasts on all those popular platforms. Sunny morning on this Friday, 58 degrees outside our studios here at San Juan College. We are expecting a mostly sunny day today with a high of 83 this afternoon. A clear night tonight with a low of 49. Sunshine on Saturday with a high of 84, but maybe a scattered shower or thunderstorm popping up. 57 overnight. Cooler on Sunday with a high of 78 with a chance of a shower or a thunderstorm. 73 on Monday. 74 for a high on Tuesday. Only 71 on Wednesday, and overnight lows in the mid-40s.
Good morning, everyone. I'm Megan Cullip, along here with Scott Michlin.
Good morning. It's Friday once again.
I always breathe this. I feel like I'm always sighing, like a sigh of relief.
I think, well, another week, and here we are.
I know.
Yeah.
I mean, time
we made it.
passes,
Another
which
week.
I don't like, but Fridays are great.
That's true.
Yeah.
Very true. And on this Friday, this is our COVID-19 Friday. We're doing the COVID-19 program every other Friday, of course, as folks know, to still get information out to the local community. Next Friday will be our Solutions from the Street Friday.
Yes, it will.
So it'll be a different focus. But this morning we are talking about COVID-19. And, of course, one of our very favorite guests who is here to talk about COVID-19 and give us an update is the one and only Dr. Bob Underwood from San Juan Regional Medical Center. Right? And he's on the phone.
He is on the phone. He's part of Team SJRMC.
That's right.
I call them.
There you go. Dr. Underwood, good morning.
Good morning, Scott. Good morning, Megan. How are you?
I'm
Good.
well.
Yeah.
I won't speak for Megan, but I think she's okay.
We're
She
both-
made it to Friday.
We're both well, yes.
So
Indeed.
thank you for being with us yet again. And let's start, I guess, by just giving us a quick update on conditions at the hospital. We've seen kind of case numbers rise, and I think I saw that they're maybe falling a little bit, but you tell us how things look today.
Yeah, absolutely. So, yes, the hospital is full, but it's not necessarily just COVID patients. In fact, for the last 3 days, the number of COVID patients that we've had in our hospital has been flat. It hasn't changed at all over that time frame. Some people going home, other people being admitted, but it's not increasing, which is the part that we're trying to make sure stays that way. But our overall census of total patients is actually quite high, in the 160s as of today. So it's not all COVID patients, though. It is a number of different pathologies, injuries, the kinds of things that we take care of as a hospital all of the time. So busy hospital, but nowhere near where we were back in our really big surge of COVID. We're at about 32 patients right now in the hospital. Now, of that, 9 of those patients are in the ICU. 9 of those COVID patients are in the ICU, and 7 of them are on ventilators. So that still shows that it's a very serious disease. There's no denying that. And the acuity of that patient, of course, makes it not very many patients, but a lot of work behind those patients, a lot of severity behind those patients. As we've talked about before, but not every listener may know that we have an ICU, kind of what we call a step-down unit, which is for patients who don't necessarily need that level of care, and we've had to convert that into another ICU, and we do have some ICU-level patients in that area right now as well. So busy as a hospital, and some proportion-wise, some pretty sick people, and those are some of our COVID patients that we're seeing. Another question that people have is, are they vaccinated? Are they not vaccinated? The answer is what we have been seeing at our facility is about 15% of our admitted patients are vaccinated, which means 85% of our patients are not vaccinated. So a very significantly higher proportion of patients who are not vaccinated end up in the hospital, and they are the ones also who get sicker than the other patients that we see. It's protective from hospitalization with COVID, and it's also protected of severity of disease if you have had the vaccination.
Very good. And so speaking of vaccines, we have heard a lot about the third shot, the booster, and I feel like the information's gotten a little muddied. Who needs it? When should they get it? How long after the other 2 doses? All of that. So maybe you can unmuddy the waters for us about this third shot.
Sure. As much as I can right now. Now, the FDA heard the research a week ago, so last Friday, about the third dose for the Pfizer vaccine. And so they were looking at all of the data. What we have seen, and we're still waiting for a final report to come out, but what we've seen about that is there is a recommendation for people, not for everybody, to get a third dose. It is for those who are immune suppressed, those who are elderly, which are people who are likely to get more ill from the disease, and then also for those who have a higher risk of being exposed to COVID. Healthcare workers, of course, falls into that category. for them to get a third dose. That is a recommendation 8 months after your second dose has been administered. And I know, Megan, that you like to geek out on the science, but the long and short of
Yes.
it is the type of antibodies that you develop from the vaccine and how those wane over time. And so that's where the recommendation of the third dose has come from. Like I said, we're still waiting for the official report to come out and the official recommendations, but that's what we understand the decision to have been made.
Got it. And it seems, Dr. Underwood, that everyone is saying we need kind of more time to study the effects of these boosters on the rest of the population, but it seems to me that eventually we'll probably start seeing those notifications and decisions about boosters for populations younger than 65 and the other non-high-risk professions and maybe things along that line. And I guess the other part of the question is San Juan County and the state already has an infrastructure in place to give out the vaccines, doses 1 and 2, so I would assume when it's time for a booster, that setup will continue to go pretty well for anyone who wants a booster or is eligible for a booster. That's what I'm trying to say.
And I think that that's absolutely accurate. If history, in terms of what is processed so far, plays out again, then yes, we would anticipate that would be a natural progression of the recommendation, is that it will be more broadly recommended. And of course, we're going to be ready to accommodate that. We've had now several rounds of vaccine administrations to practice, and we've gotten pretty good at it. And I think even with the first release, we did very well at getting the vaccines out to those who were eligible for the vaccine as quickly as possible, and I think it will just be improved above and beyond that, just because we've had the ability to test that infrastructure and know how it works well.
Very good. And so one more shot question, but this is different. This is the flu shot because we're heading into flu season. I know last year flu season was almost non-existent, but I presume that's because everybody was masking, washing their hands, and staying away from each other. But now that things have kind of changed a bit, and so flu shot, do we recommend? And what about when it comes to the possible overlapping of the COVID vaccine? Is there a period of time to wait between the two?
No, they can be given simultaneously if it happened to fall in that pattern. So there is no conflict between getting the regular flu shot and the COVID vaccine. And yes, flu season is coming about, and the CDC recommends that people get vaccinated for the flu, preferably by the end of October. It takes about 2 weeks for the vaccination, just like any vaccination, about 2 weeks for antibodies to develop in the body and provide you the full protection against the flu. So, we don't want anybody to delay getting their flu vaccination. And I think you're right. Last year, because of social distancing, wearing a mask, the influenza never got an opportunity to really get a foothold in any community. There were very, very few, like I've never seen before, reported influenza cases across the state or really even across the country, which is great. We don't expect we'll be that lucky this year because, the patterns have changed. So, and in fact, we encourage everybody to get a flu shot. We will be holding 2 drive-through clinics here at the hospital. This is for adults only. One of them will be on Saturday, October the 23rd, and then again on Saturday, October the 30th. We'll start around 9 o'clock in the morning, and we'll run till noon or until we run out of vaccinations. So we really, really recommend getting the vaccine. Again, that's adults only. It's first come, first serve. It's really done at a drive-through. All of the important information is available on our website. So that's sanjuanregional.com, and it's free. So we're committed to keeping the community healthy, so we really recommend people come through and get their vaccines that way. I had family members who did it last year, and it's so fast and simple, it's not even funny. Drive through and get your flu shot, and you're on your way.
There you go. You guys have it down to a science, if you'll pardon me saying. But yeah, And Dr. Underwood, I want to ask you about I guess while we're on the flu and flu vaccine, because the season was so almost non-existent last year, do we know, normally I think we track some of this stuff from the southern hemisphere of how bad the flu season will be in the northern hemisphere this year. So do we even know what they were dealing with over their winter to even know how to prepare for this flu season?
So I would say that the amount of data is less than it would normally be, but we do have data around strains that have been running in the breakthrough cases. And it's based off of last year's information, but also some on the year before that. So, in the end, on average, the flu vaccine has an effectivity, on average, of about 60 to 65% in terms of being effective against the strain that's there. I've been around healthcare long enough to have seen some years where the coverage was fantastic and other years not so good. So we think we'll still be in the window of where it has been in the past. But that's a question that's been asked several times is, what are we basing it off of if there was no flu? And the answer is it's not that there was no flu. It's that there was very little of it. Which is encouraging. Nonetheless, we do have some basis on which to that the powers that be at the CDC will come about with this year's recommendation. In fact, it's already being distributed. So that's where they came about, getting all of that information and making sure that we had the right strains covered.
Very good. And let's talk variants real quick. I mean, the last time that we had a doc on, Dr. Brad Greenberg informed us that pretty much if you have COVID at this point, it is the Delta variant. There is talk about the Mu variant. Is that going on? Have we seen that? What's the status there?
We have not seen that. So, of course, they changed the way that their naming was from the country. Now they're following the Greek alphabet. The Mu variant is out there, but we're not really seeing anything like that here. And Brad is spot on with his commentary that if you have COVID right now in the state of New Mexico, it's the Delta variant. We haven't really seen anything over, and it has absolutely dominated the variant profile that they're running on the positive tests that we're seeing in New Mexico. Now, there's a couple of others that are of interest, so they're kind of watching what they're doing, but again, the only thing that we're seeing or worried about right now is Delta.
Got it. And that's a good point, I think, Dr. Underwood, is to say that there have been other variants that have gone through the Greek alphabet so far, up to this point. They just haven't taken off like this Delta has and had the transmissibility rates and some of the other things that this Delta variant has, which has made it just so dangerous and so worthy of study and precautions against, correct?
Yeah, that's absolutely correct. So the CDC has a way of classifying these as variants of interest and variants of concern. And so the ones that are of concern are kind of what you just described. They can be more dangerous, more virulent, have a possibility of evading your immunologic response to previously being infected or from having a vaccine. And the other variants haven't moved out of the variant of interest into the variant of concern. To kind of put it in their categorization process.
Great. Well, Dr. Underwood, thank you so much for joining us today. As always, we so appreciate, geeking out on the science. That's what I appreciate. But also just
should have seen her.
You should have seen me. It's radio, so you can't, but you should have seen me.
Yeah.
And just unmuddying the waters. There's so much information out there. Some of it is valid, some of it is not, and it's helpful to hear somebody who knows what they're talking about. So thank you.
Yeah, absolutely. I appreciate being on. I appreciate being able to reach out to the community. You guys have been great partners with us to try to make sure that we can get information out to the community that we're really here to try to protect and care for. So we greatly appreciate you as well.
Well, we're happy to work with you and continue the partnership. So thank you very much, Dr. Underwood. We'll talk to you again soon.
Yes, sir.
Thank you very much. That's Dr. Bob Underwood from San Juan Regional Medical Center. And again, this is our COVID-19 Community Information Program, and we do this program every other Friday so that the community can get informed about local information about COVID and not have it coming out of Santa Fe or Albuquerque, and have it on the radio too. So if you're not a Facebook person or a YouTube person or Twitter person, you can listen to your radio and get the local information.
That's right.
The old-fashioned way.
You should always have a radio. Didn't they teach you in the disaster preparedness class that you have to have a radio because when other forms disappear, you at least have your little battery-powered radio?
Exactly. I have a radio that has a crank.
Do you really? Oh, yeah.
The batteries
right,
go. And a solar panel.
Yeah.
And a little solar thing on the top, too.
I'm behind you. I don't have that yet.
See? You need to get you one.
Amazon.
We'll get you one. There you go. Exactly. Anyway, we appreciate Dr. Underwood calling in. And, of course, there's more information to share, though, about COVID this week. So let me show you a little bit of that, of what we want to share. And one of them is the weekly cases that we're getting from the dashboard that's still going. The state, remember the old color dashboard? We talked about this last time, and everyone's still in red, by the way. But we're not.
They're bearing the lead now, huh?
Yeah, kind of.
We don't want to discourage.
Exactly. But if you notice, this is San Juan County, and so these are the numbers of cases that they've been keeping track of since it goes back to March of 2020. And you can see the surges in cases that we have had. And so the trend in San Juan County is going down, which is hopeful and positive. And so we kind of are excited to see that, and hopefully it will continue. As Dr. Underwood said, they don't have as many cases at the hospital as they had during the peak, and you can see where that was way back in December when we had so many cases. And so now, we've kind of peaked here now most recently, maybe in mid-August, and things are kind of coming back down again. So we'll see how it goes. We'll keep following that for you over the next 2 weeks.
Good.
So till we meet again. We want to remind you about COVID testing, because the vaccines are now available pretty much all over the place. Pharmacies, stores, Sam's Club, your doctor's office. I think a lot of places are giving out vaccines. But still, if you want to get tested, if you think you have symptoms.
Or you've come into contact with somebody who has COVID.
Right. There is testing going on at a number of locations, and so I thought it was important just to kind of point out and remind folks that there are 3 locations in San Juan County that you can definitely get a COVID test. On one of them at curative.com, that's kind of what the state is using, so you register on there. And Aztec Schools has them on Wednesdays and Fridays, so today, from right now, from 7 a.m. until 3 p.m., you can get a COVID test at Aztec Schools at Fred Cook Stadium, and so that is happening today. You can register at curative.com, so there's that location. We've known about the McGee Park location. They've been doing it forever.
Oh, so long.
Right?
Yeah.
And they are pretty much Monday through Friday, 8 to 3, so they'll be there until 3 o'clock again. And I think what's notable is, and I didn't know that they had changed the swabbing.
Yes.
Right? It's now a shallow swab.
Yeah.
No longer the almost to your brain swab.
Yeah. They actually haven't used nasopharyngeal for a long time because, of course, that was a resistance that
it was uncomfortable.
People did not want to submit to that. So
this is a lot. So if you never got tested
easy.
because of that, this is important, I think. It's only going to go in maybe, what does it say?
Half an inch.
Half an inch.
It's really not bad. We get tested all the time.
My nose is that long, so I'm not even going to feel it, right?
I think your nose is a little longer than half an inch.
Okay. Anyway,
it's radio. They can't see.
They can't, no. But you get the idea. It's a
Yeah,
very
it's not
small measurement.
It's not bad.
You're not going to feel
Yeah.
much,
No.
if anything. So McGee Park, and then the third location that I want to mention is at the Farmington Schools District Office. They are doing COVID PCR tests, and that is on Monday, Tuesdays, and Thursdays is when they are doing those, and I believe it's during regular business hours. So that's on 30th Street. So the new Farmington Schools District Office on 30th Street, which also where some San Juan College offices are too.
That's right.
So at that location. So we wanted to pass that along to remind everybody about that.
Right.
So there you go. Watchlist is back. We talked about that 2 weeks ago, right? We still have places on the watch list, but no closures. So, a couple of these locations have more than 4 rapid responses, but they are not closing places down, again, because they may have an agreement with the state in certain training and certain standards, and so, they kind of change that a little bit to not close places down. So, for our radio audience, Aztec Healthcare has 2 rapid responses, the Life Care Center of Farmington with 7, Physical therapy and sports medicine on Main Avenue in Aztec with 4. Lowe's had 2 recently, and this is updated daily, I believe, from the State Environment Department. San Juan Veterinary Hospital on Browning Parkway had 2. West Main Walmart with 2. Wendy's at 4903 East Main with 2. Aztec's Kugler Middle School with 2. And Rocinante High School in Farmington with 2. Tibbetts Middle School in Farmington with 2. Lydia Rippey in Aztec with 2. And Blanco Elementary School in the Bloomfield area with 3. And so that's the rapid responses.
Pretty much schools in congregational settings.
Right.
Makes sense.
Right. I'm sorry, and 3 more. Kirtland Middle School, Farmington High School with 2, and Piedra Vista has 3. Kirtland Middle had 2.
Yeah.
Now I think that's the list. There's a lot.
Yes. Schools, congregational settings.
Yes.
Makes sense.
And I think, as we've opened the schools, right, to more face-to-face, that just goes without saying that's going to be probably more rapid responses.
More and more children.
Yeah.
Yeah.
That are in proximity and
Yep.
running around together. The other thing from the State Environment Department that I noticed that I thought was worth sharing was the rapid response by counties and how we're ranked across the state, right? And so San Juan County, if you look down the list on the screen there, we're ranked number 5 of the most rapid responses. And that kind of makes sense because I think we are one of the larger counties by population in the state. So that represents about 5% of all the rapid responses for the last week. And we moved up from number 7 last week. You don't want to move up on that list.
No.
So
we would like to decline on that list.
Right.
Yeah.
But Bernalillo is top, which you can imagine with Albuquerque.
Right.
Right. And then Eddy County is second, and that is in the southeast part of the state, in Lee County, and then Doña Ana, which is the home of Las Cruces, as 4th, and San Juan County comes in at 5th, as we've mentioned. Then you have Curry County, Sandoval, Santa Fe, Chavez, and Otero round out the top 10. So there's that.
There's that.
So, interesting.
Ooh, yeah, I know, right?
Exactly.
Yeah.
And then this is something that I thought was kind of interesting. I don't know if you can really see it too clearly on the screen, but this is the breakdown of the type of business for the rapid responses, right, from the state. And that's from
really interesting.
Back in May, all 2020, all the way through September 19th.
Okay.
And so the largest segment, pretty much, is, as you might imagine, 14.5% healthcare.
Sure.
And then it goes to retail, non-food retail at 11%, right? And there's some others too.
Educational services is second.
12.6, yep.
And then it's retail.
And then it's retail.
Yeah.
Right. Thank you for that. And then it goes down to, I'm trying to see.
Real estate.
Real estate is the next one, right?
Which I'm surprised by.
Right. Interesting. And then transportation.
Restaurants and public administration, yeah.
Right.
So,
where's that?
anyway.
I'm looking. Are there 6%?
Restaurants is, yeah,
6%.
the yellows, yeah, square.
6%. And then, and there you go. And then you've got food and beverage stores at 4.5. But anyway, mining, oil, and gas extraction, 1%.
Mm-hmm. Well, you're out there with the rigs.
Right.
That's about it.
True.
Yeah.
But I'm just saying.
This
Worth noting, I think.
Worth noting,
Yeah.
yes.
So there you go. Anyway. So I thought that was interesting to
It
share.
is interesting. I like a good pie chart, too. I like a good pie.
I was going to say.
And I like a good pie chart.
You like a good pie.
I
so
love a good pie.
I understand. There you go. But I think that brings us to an end for our program today. And anything else to share?
No, just next week, Solutions from the Street, we have a different solution.
Right.
Same street, I guess.
Same street, new solution.
Yeah.
Right, exactly. But that's our new kind of solutions-focused journalism program here at KSJE, designed to just not report on the problem, but also present a solution. And so we're excited for this new program. It's kind of fun to do.
It's very fun. It's
A lot
very
of
uplifting.
enlightening. Yeah, I like that. And if you missed them, they're online. You can listen to them on podcast. Just check out the podcast and subscribe where you get your favorite podcast, or watch it on our YouTube channel or Facebook page or Twitter account. You can catch them there too.
Yep.
So there you go. Well, until next week, everybody, stay well and stay safe. We will see you next Friday. Have a good week. The New Mexico Outdoor Economics Conference is happening in Farmington, September 29th through October 1st. The conference features panel discussions, outdoor tours, social gatherings, and top leaders from the outdoor industry. The Outdoor Company Expo will be free to attend at the Farmington Civic Center. Registration is open now at OutdoorEconomics.com. That's OutdoorEconomics.com. The New Mexico Outdoor Economics Conference, September 29th through October 1st. KSJE is supported by the Farmington Civic Center, bringing a wide variety of live entertainment to the Four Corners. Country music, classic rock, and ballet, all on stage this fall. Also, on-stage theatrical performances of The Rocky Horror Show and the holiday classic A Christmas Carol. Find out more online at fmtn.org/shows.